Tell me about the gender knee. How did it evolve?
Well, it really evolved here at the University of Tennessee in the biomedical department. The body farm here, they analyzed all the data and compiled that and then created a bunch of graphs, and they actually found about 40 different statistical differences between a man's knee and a lady's knee. 3 are very, very important.
So 40 differences between men and women's knee, 3 of which are major. Now,
yes.
We have a picture here. Why don't you hold it there for me? A picture of a man's knee or a woman's knee?
It's both. It's an
both.
Overlay of the end of the femur, like you're looking at your finger end on.
Okay, the femur is the big thigh bone.
Absolutely.
And this is at the end of it.
And that's the inside and that's the outside.
Okay, inside and outside.
And a guy's knee, for any particular size, top to bottom, a guy's knee is wider. Okay, now, so it is bigger.
We would normally think that, and lo and behold it is. Men are bigger than women, they have bigger knees.
But not in the front to bottom dimension, only in side to side.
Only side to side. So put your finger around the men's knee, the man's knee.
The man's knee is here with the outline in blue.
And the woman's knee?
Outline in pink.
Now, there's a huge difference there when it gets down to knee replacement. Does that mean you're going to have to shape them differently?
You have to make compromises sometimes to put a lady's total knee in that you don't have to with a guy. And so if you can avoid that, it would fit better. I mean, your wife wouldn't wear your pants or you wouldn't wear her shoes. Even though they may be the same length, you'd have a different fit based on shape and size.
It would take 2 of my wives to get in my pants, I think, as far as size goes. Tell us, here's another graph that you've got that's the difference between men and women. Tell me about this and why it's important.
Absolutely. This chart shows that for any given height of a femur, of the thigh bone, the width changes. And the blue line indicates that the average of all the men's knees falls on that blue line. And the average of all the ladies' knees falls on that pink line. In the past, all implant companies have had to make one size, a unisex size, that either is more toward the blue line or the pink line, but it has never been both.
So they're not going to fit as good as maybe we thought, or they're going to fit better in the future here?
Both. We've made compromises to make it work. Now with this development, with specifically tailoring a knee designed for a lady's anatomy, it should fit a lady much better, and those patients should get a much better result and fit and function than they did before.